An important part of the Hunter syndrome journey involves an aspect of the management of this disease that is less often considered: emotional management. In a previous video, we covered some of the medical specialists who may be involved in the management of Hunter syndrome symptoms. However, it is important to also acknowledge the emotional burden that accompanies these symptoms. On top of symptom management, the emotional and psychological aspects of living with Hunter syndrome will require care and attention, especially as much of this impact will be managed by caregivers. It is often the patient's family and caregivers who will assume the role of behavior therapists, counselors, in-home nurses, special educators, protectors, and advocates. Some may seek help from trained counselors or psychologists. However, a great deal of this type of management inevitably falls on those closest to the patient. This means that alongside managing the patient's emotional challenges with Hunter syndrome, caregivers also have to deal with their own response to their child's diagnosis, together with any of their own personal difficulties. Many of the emotional complications experienced by patients arise from their difficulties in expressing themselves and how they feel to their caregivers and peers. This is more common among patients who have a more severe form of Hunter syndrome, which can have a neurological impact. This can lead to a wide range of symptoms that affect their emotions and influence their behavior. This behavior can often be misinterpreted as aggression or defiance, with attempts to communicate or express interest in others appearing to cross social boundaries with other children or parents. Outside the home, in settings such as school, when others misinterpret these behavioral symptoms, it can cause problems. To combat this, it is important to raise awareness of Hunter syndrome and its neurological symptoms to educate others about this type of complex symptom expression. For families and caregivers, a lot of the emotional challenges also arise from a lack of awareness of the condition among both loved ones and strangers alike. Some of the other emotional stressors that families report experiencing include worrying about their child's future, their child's pain, how their child will cope with having MPS II, and social isolation. If their child has limited communication capabilities, it can be especially stressful for caregivers when they cannot fully understand their child's needs or how to help. While it is important for families to understand the emotional impact of MPS II, it is equally important to know that support is available. Family members managing Hunter syndrome may find it useful to attend family counseling, join a patient organization such as the National MPS Society, or attend in-person and online support groups. It is also critical for caregivers to take the time to care for themselves so that they are better able to take care of their loved ones. Some ways for caregivers to look after themselves include attending therapy, staying active, maintaining employment, positive thinking, support from others, and going out with friends. Overall, we have seen how the complexities of Hunter syndrome can cause a range of emotional difficulties for both patients and caregivers. It is important to remember that there is always help available, especially as many caregivers can find themselves facing these emotional challenges without much external help. Hunter syndrome is a complex and often misunderstood condition, which often requires parents and caregivers to provide extensive emotional management. It is vital to raise awareness of this rare disease in order to help families get the help they need as early as possible. Greater awareness of Hunter syndrome can also aid understanding of patient and caregiver needs, which in turn can help others ease the burden currently placed on families living with this condition. There are a number of resources out there dedicated to raising awareness and providing more information about Hunter syndrome. Visit hunterpatients.com today to learn more and help those on this journey. Talk to your doctor if you are concerned about symptoms or have any other questions about Hunter syndrome.